Welcome. I'm Randy Twaniak, owner of Expedia Cruises, Edmonton West location. It's January 2021, and this will be the year that many of us will begin to travel the world again and see the world. Traveling will be different and in some ways more complicated as we deal with COVID issues in our own country and in countries around the world. There will be new rules with each country deciding on its entry requirements, and pre-trip COVID testing may be required. We want to make sure our clients get back to traveling safely and informed of all the new policies and procedures. My team of 24 professional vacation consultants are here for you, not only to plan your bucket list travels, but also to help you navigate through the complexities of travel so that we can get you back traveling and doing it safely. Today, we bring you Kim Lucy, Director of Business Development, Western Canada for Viking River and Viking Ocean Cruises. Kim will be letting us know what Viking is doing and has done to make sure you can sail safely on the rivers and the ocean. The protocols and safety measures Viking River and Viking Ocean Cruises has put into place are ever-changing based on current scientific data and country requirements to ensure maximum safety for crew, passengers, and the countries they visit. Welcome, Kim, and thanks for joining us today.
Well, thank you, Randy. Thank you for inviting me to join your clients today to share with them some of the health and safety protocols that we're doing to make you feel safe to come back to cruising. So today I'm going to take you through the different protocols that we currently have put onto our ships, and we are looking forward to welcoming everybody back to sail with us. So I'm going to turn my camera off and I'm going to take you through this. We do have a video from our chairman, who has been on board our ships and is going to show you firsthand what we're doing. So thank you for joining me. So Viking, as you know, we have products all around the world. We have river ships sailing around Europe, Russia, China, Vietnam, Cambodia, as well as Egypt. And we have 8 ocean ships that are currently sailing around the world. Well, they will be sailing around the world as soon as possible. And on all of these ships, we are ready to return to service. So I wanted to go through all the safety and health protocols that we've put in place. We've been developing these in coordination with an international team of scientific and medical advisors. We have probably one of the most well-researched and comprehensive COVID prevention plans in the travel industry, and that is going to include a variety of things, including daily PCR testing, which is the saliva testing, which has been considered one of the best ways to detect both symptomatic and non-symptomatic guests. We have built these laboratories right on board our ocean ships, and we are working in conjunction with laboratories in the ports of call along the rivers as well, because the ships are a little too small to have the laboratories right on board. We have new air purification technology that's been installed in all of the ships. Individually, each of the staterooms have always had individual air, and we do not have inside staterooms on all of our ships. So there's always fresh air, doors and windows that can be opened. But we are going to, we've implemented other air purifying systems for the public areas. And we will be doing additional health checks, sanitation, and physical distancing to make sure that both our guests and our crew stay safe throughout the journey. So I thought the best way to start this is to give you, let you hear it from our chairmans directly, and to have a chance to see what we're doing on board the ships.
Dear Viking guests, I am on board the Viking Star with colleagues. We are here to complete the work needed to have the Viking fleet return to safe sailing. It has been great to be back on board again. Over the past few months, we have all missed the opportunity to travel the world. I want to share with you that we have implemented the very highest standards of precautions on board our ships to ensure that travel with Viking is as safe as it can be in 2021. I'm extremely pleased to note that our Viking ships have structural advantages that also make them well suited for these times. Our ships are small, and all our ocean ships have balconies no shared air between guest cabins, and plenty of public space, as well as outdoor dining, which we all like. To make the ships even more suitable for COVID times, there are a few enhancements we have felt it appropriate to make. But it's remarkable how little impact this will have on your next experience on board. There are now automated cameras that take your temperature on both ocean and river ships. On the ocean ships, we have 2 UVC robots. They are at work to disinfect public spaces while you'll be asleep. And the air ventilation systems have been equipped with UVC light and electrostatic filters. These are not noticeable to you, but are proven to kill 99.9% of the pathogens. That includes the COVID virus. We now have a little bit more distance between the dining tables. They were already well spaced out. You will not notice a big difference from before. And in case of our river ships, I think it makes the experience even nicer. But the key to making ships safe for the future lies in testing, in the testing program that we have developed, which far exceeds the requirements of various governments around the world, and I dare say, of any of our competitors. There is wide agreement that the best testing method for COVID-19 is PCR, and also that daily tests, if you could do them, are important to avoid spread of the virus on board. The problem with that for the industry has been the difficulty of having enough testing capacity on board. But at Viking, we have gone to the step of installing full-scale PCR laboratories on our ocean ships, plus a network of shoreside PCR labs on our river ships. One of our onboard labs is already installed and working here on the Viking Star using non-invasive saliva sampling, not the uncomfortable nasal swabs used elsewhere. I've been on board for a couple of days and can testify that this is truly a non-invasive method, and it takes only seconds of your time every morning before you brush your teeth in the privacy of your own cabin as it is. We have based our health and safety protocols on epidemiological modeling by industry experts and the involvement of Dr. Raquel Bono, a retired Vice Admiral of the US Navy. Dr. Bono has already been working with us several months, developing our protocols, and I'm pleased to say she is now a permanent member of our Viking family, holding the position of Chief Health Officer. We also have a partnership with one of the leading medical diagnostic firms in the world, Medicover, who will be running our labs on board on the ocean ships and provide the land-based labs for our river ships. Now, our experts agree, with daily PCR testing, it is possible to virtually eliminate any spread of virus on board our ocean or river ships. So that's like any ocean or river ship. With daily PCR testing, one can also operate longer cruises without any significant risk of community spread on board the ships, not limiting oneself to 7 days or 4 days or whatever. You can operate proper cruises. In fact, with daily PCR testing of guests and importantly of the crew, our modeling shows that most of us would be better off being on board a ship under our protocols than going about our daily lives at home. So that's not too bad. We are also optimistic about the significant progress towards multiple vaccines. The recent results from 3 trials are very promising. In the UK, the vaccine is already being rolled out this week. And in the US, we could see approval of the first vaccine in the coming days. I'm happy to observe that the time is drawing closer to us being able to welcome you back on board again. As things stand, our clear aim is to become operational again by around April 1st. And we look so much forward to exploring more of the world with you, in comfort as usual, and with great confidence. Thank you.
So I don't know about you, Randy, but I hope that makes your clients feel a lot safer. It certainly does me when I watch that video and I see all of the protocols that are being put in place to sail safely again. So let's take a look a little bit more in depth at what we're going to be doing. So we're going to be starting, I wanted to start with the very beginning and how people are getting ready before they go. So we are right from the planning period. We will be we've set up a situation right now with our risk-free guarantee so that you can cruise with confidence and you can cancel up to 24 hours prior to departure. This is in place right now. I don't know how long that's going to last. It's going to depend on when we can actually start sailing again. But I encourage your guests to talk with your advisors and take a look at what's available for them. But we also really encourage you to purchase travel protection insurance because if anything happens, you will be removed or disembarked from the ship, and you'll be in a situation where you need to get home, and that's where travel protection is very, very important. You'll also be asked to fill out a health questionnaire that will be similar to the ones we're familiar with through SARS. And these will be done prior to departure on the My Viking Journey site. These will be sent to doctors. They won't be read by Viking. These are things that are going straight to the health professionals that we're working with, and they will look through them and flag anybody that needs additional attention, and they'll follow up with questions. So we have this health questionnaire has been developed by medical advisors and scientific advisors, and we've been working very, very closely with. Once you set sail, or once you get ready to travel, we will be working with the various airlines. They, as you can see, have many health protocols already in place as well. Viking provides a seamless experience because we do work very closely with a lot of our airline partners around the world. We're one of the largest purchasers of air in the cruise industry, and we are continuing to work very, very closely to ensure the safety of our guests from home to home, so to speak. So we'll be working with them. But once guests arrive, we'll be providing transfers. So those who arrive with our flights will receive a complimentary airport transfer. We will be transferring guests in smaller groups to and from the ship, and we'll also be working, we'll be providing sanitized motor coaches that have been set up with physical distancing. And these coaches are being cleaned regularly. They're being cleaned between transfers, and we've got all the health and safety protocols in place as well on the coaches. Now, if you are coming in on your own, you can purchase a transfer from Viking, and you'll be able to be met and transferred as well. Or you can certainly work with the Expedia team to set up your own air. So once you get to the embarkation point, we will be assigning you boarding times based on your flight arrivals. And we will have check-in counters that will be spread out to ensure proper distancing. And we will be sanitizing those between every guest, just like you see in some of the grocery stores using the pin pads. A touch-free online check-in option will be available. And we have developed this both on the river and the ocean ships, so guests will be able to go directly to their stateroom. They'll be able to check in and do that. And in cooperation with our local partners, all of the cruise terminals and the port terminals that we'll be using will be sanitized prior to our guests arriving. Once you get on board, you will receive a temperature check by a touchless thermometer, and you will complete another health questionnaire. So once you're on board, you will receive a quick and non-invasive saliva PCR test as part of the embarkation process. And then you will be asked to go to your stateroom and stay in your stateroom until the results have been processed. So this is times, depending on the local regulations and your travel itinerary, you may also be asked to wait for your test in your pre-cruise hotel or a designated waiting area. So if we have a pre or post program, we'll be doing the testing prior to you arriving at the ship. If you're flying in and boarding the ship directly, you will be given the saliva test and you will be asked to wait in your room until the tests have been completed and we know whether or not there's a positive or a negative test result. And at that point, you'll be able to go out into the public areas. So I think that's a good, safe way to do it. Now, I wanted to really stress that one of the big advantages we have with Viking is that our ships are small. In Switzerland or on the rivers in Europe in particular, our ships are all Swiss registered and they host just 190 guests or fewer. We are going to be taking staterooms out for quarantine if necessary, so we will be reducing our capacity to accommodate those. So our guest count will be a little bit lower. Our fleet of ocean ships are under our 930 guests. And again, we will have quarantine cabins set aside, so that passenger count will be a little bit lower as well. It really is going to depend on where we are when we're able to start sailing. But the smaller ships already provide a safer environment because you can spread out. We already have more space per passenger. We have a lot more outdoor space, and on both the Viking river and ocean ships, all of our staterooms, with the exception of our standard staterooms on our river ships, which will probably be used for quarantining, have open windows that open. We have a lot of outdoor deck space and lots of fresh air. So there are no guests are going to feel comfortable. They're going to have access to fresh air. The health check, our Viking ocean and river ships feature independent air handling units in each of the rooms. And these are, the rooms are, so there's no sharing of air, which is one of the big concerns earlier on ships. The air in the public areas of your stateroom will also be purified with the shortwave ultraviolet UV lights and the high density filters. They actually go through 3 different steps of purification before they actually get back out into the public areas. So that's been proven to kill 99.99% of all airborne viruses and bacteria. So that's better than going to the grocery store. Definitely. So Audit Ward, we have daily PCR testing. So this is non-invasive, as I mentioned, by a saliva sample. You saw how that was done. And it will be conducted prior to departing your stateroom every single day. This will be done in the privacy of your stateroom and will be picked up by our staff. Then it will go to our dedicated PCR labs that are being built on each one of our ocean ships. And as you heard, we will be working with labs in the individual ports of call that will do that testing for us with the rivers because they're too small for the actual laboratories. No other cruise line has got this facility on board. We are the first cruise line to complete the installation of these laboratories at sea. Each of them will have them, and we have a strong network, as I mentioned, of shoreside labs that will be working with us for the river ships. So once you're on board, we will have medical services that with a state-of-the-art medical center, and those have been upgraded with more specialized equipment. We're actually adding some additional health personnel that will be there, both lab technicians as well as an additional nurse. And we will also have a 24-hour hotline that will be staffed by doctors, especially for our river cruises. Depending on what needs to happen as we get closer, we'll be able to let you know what the additional medical services provided will be. And the regular health check monitoring will verify the wellness of each of our guests during the sailing. The short questionnaires will be completed every day, and the temperature checks will be conducted effortlessly with the automated thermal cameras that you'll find throughout the ship and in the corridors. So we'll be able to, through facial recognition, be able to test and check everybody in a non-invasive way. And if there's any concerns, those guests will be notified by our health professionals and will be ready to go if necessary. Sanitation, we talked about all the surfaces will be cleaned and sanitized with daily scheduled deep cleaning. A lot of that will be done while you're sleeping. And you'll also notice more hand sanitizer stations throughout the ship. These will be touchless. And we're also adding the new sanitation robots that will utilize the UV lights to treat the surfaces in both the guest and the crew public areas. This is an industry first. These are the robots that they're using in the hospitals. In addition to that, we will have fogging devices that we'll be using on our river ships as well. So as far as masks are concerned, we will be instituting physical distancing measures. You will see the signs. They're getting ready to put those in. Throughout the ship, there will be all kinds of posters and things to remind people. Face masks will be required for all guests and crew members moving around the ship, and that depends on the conditions at the time of sailing. We'll just see what's required by each of the ports of call as we go, but at the moment, we will be asking for face masks. They won't be used while we're seated in the dining room, the bars, and the lounges because we have implemented or installed plexiglass barriers in and around a lot of public areas. And we've physically distanced to the regulations for all the tables as well. In the fitness center and the spa will remain open by appointment only, and all of our spa staff will be wearing face masks during treatments. The fitness center will also remain open and will be sanitized between guests as well. So, and again, that will be, we have 3 separate compartments for our fitness areas, so we'll be able to physically distance people, and we'll be able to make sure that people stay safe. If it's highly used, then we'll be setting up a reservation system, but at the moment, based on past usage, we feel that we should be fine. When we go out on the shore excursions, we already have designed shore excursions that have smaller groups as well, but we are redesigning our land programs to monitor the destinations for the prevalence of COVID-19, and we will further limit group sizes. If there's an issue, we will make adjustments to the itinerary or to the tours that we'll be doing, and you will only be able to take Viking shore excursions in the port of call, so that we can contain and we can control how these tours are run and how safe you are. So every one of our suppliers will be required to adhere to our standards and will be trained by us, and to make sure that our guests remain in their safety bubble, and we aren't exposing them or any of our crew to any danger. Each shore excursion will utilize our audio headsets, which we've always done, and that allows for easy physical distancing among the group. The motor coaches will be fully sanitized, and we are spacing everybody out. So a 52-seater coach will be reduced down to about 25 to 30, so there'll be lots of space. Every second row of seats will not be used. So these are things that will, again, help to create that physical distancing. Complimentary face masks and sanitizer will be there. There'll be hand sanitizer stations available on the buses as well. So we'll be making sure that we maintain the social distancing and anything else that's required by the locals that we're visiting. So our local partners, as I mentioned, will be part of our health and safety protocol. They will be regularly tested, and we will be training every single local partner, including the drivers and the tour guides, and we will meet or exceed the local guidelines required in the ports of call. Once our guests return to the ship after a shore excursion, they can go back ashore, they can go to their rooms. Temperatures will be checked using the thermal cameras, but we won't be doing testing until the following day. So that will give you a way to, you'll understand. Once you're ready to go home, embarkation, we will again be transferring you back in a small group to the airport on a sanitized motor coach with the spaced seating. And then you'll be handed over to the airlines, and you will continue along your journey with the safety, health, and protocols that are in place with the airlines. So begin your journey home with confidence and know that both your fellow travelers and you, your well-being will be constantly monitored all the way through. So these are health and safety protocols that were put in place as of December 8th. We will continue to make changes to these as we go, depending on what's going on in the world and countries that we visit. And we'll be making these changes and posting them on our My Viking Journey website and our Viking Cruises website. So if you want to check on what's going on, you'll be able to see that and any updates on that protocol. So Randy, I think that is it. I hope that's giving you some insight, but I wanted to just also wrap up with our health experts, because we've been very proactive in working with health experts around the world. And one of the key people that has been very involved in building our program is Vice Admiral Raquel Bono. She is our Chief Health Officer, and she has a very, very strong CV. You can see here she's a certified war trauma surgeon. She's a decorated naval officer, and she has been very instrumental in helping us with all of the health and safety protocols on all of our products out there. Now, we are also working with 4 different health labs that will be helping with us. Medicover, which does the PCR testing, and we'll be working with their labs along the rivers. They've equipped the ocean ships with the PCR labs, and they are going to be working with us with the river ships as well. GNVGL is the certification that will be, they're auditing our ships and provided us with the certification, infection prevention. And remember, this is something that's going to be very positive going into the future, because even after COVID has passed, anytime you have large groups of people in contained spaces, people often come when they're not completely well, and they pass on flu or colds or a variety of other things. So all of these protocols that are in place are going to help with all of that and help you have a really fantastic vacation. Vicland is the health care and hygiene company that they're working for, and they will be the ones that help us with the medical management if for any reason a guest has to be quarantined or removed to a different facility. They will be the ones that will be helping with repatriation and continued care in that port of call. The Eagle Lab is our sanitation partner, and they're the ones that are working with us on all the sanitation, the air purifying, the robots, all of that to help and make sure that we maintain a very clean and safe environment. So, Randy, I think that wraps things up. I hope that this helps build some confidence for your guests. When they come back to travel with Viking, we are really, really ready for everybody to come back. And we're super excited to have everybody join us on whether it's one of our river ships or our beautiful ocean ships in the near future. So now's the time to start dreaming. Now's the time to start planning your trips for 2022 and 2023.
Thank you, Kim, for that information. That is incredibly impressive of what you have done to keep your crew and passengers safe. I definitely, as your chairman said, you're safer on a Viking ship than going to your local supermarket. Can't wait to get back on the water. Thank you, everybody, for watching today. We appreciate you taking the time to watch this video, and we look forward to helping you plan your future trips. Thank you.
Bye.